All right, hi there. My name is Madison Lowe, and this is my video interview. All right, so we have.
Hi, I'm Julia Martin, and I'm the interview subject for today. And I have 2 degrees under my belt. I have an associate's degree. I have a bachelor degree in dental hygiene, and I'm currently getting my master's in healthcare administration. And I'll be done in January 2021, so my 3rd degree under my belt. And my current position is a professor and first-year clinical coordinator at the Community College of Denver, where 2 of those degrees, the AAS and the BAS, were both from Community College of Denver. And I'm getting my master's in healthcare administration through the CSU up in Port.
Awesome, awesome. Okay, so what does your current job entail?
You know, my current job is definitely a lot about teaching actual clinical dental hygiene, which was definitely my strength. Before I went back and got all my degrees, I was a clinical hygienist for about 13 years before I went into teaching. So I get to teach the fundamentals, the basics of dental hygiene. So, you know, some people I think maybe it's a little more boring than regular perio and things, but I really enjoy it. But a huge part of my job that's so different from when I was an adjunct or a assistant professor is I do a lot more administrative tasks. And that's where my career has been going, is to some of this administration. So for instance, I coordinate the equipment kits for the entire new class. And that was a very exciting challenge this year with some of the shipment and supply issues. So some of that more administrative duties, assigning things, working with other people at the school to make these large tasks be achieved is the other half of my job.
Awesome. Yeah, I could see definitely the times we're living in these days, that would be challenging. Okay, so what education, experience, or preparation was necessary to be hired for your current position?
For my current position, I did need to have a master's degree. And luckily, you know, Community College of Denver worked with me. The fact that I was so far into it when I took on this position, they were like, okay, we believe you. You're on the process with that. But I feel really fortunate that I was able to show through some of my work skills that this was really the position that I wanted to end up in. One thing that I found out when I first started teaching in dental hygiene is I thought you needed to have some of these higher degrees. But when I first started as a clinical educator, you mostly need a technical education certificate. And I was able to get that even when I had my associate's degree. And I liked teaching so much, that's what motivated me to go back to school to get those higher levels. Because if I wanted to teach at the associate's degree level, I needed a bachelor's degree. And if I wanted to teach at the bachelor's degree level, I needed the master's degree, as well as the administration positions. They do prefer that. But I think most of my other preparation really had to do with being a full-time clinical dental hygienist 4 or 5 days a week for years, because I don't have as much of an academic background as some other professors, but I really have that clinical background.
Okay, very cool. It's nice to know that experience can help boost your career. So what advice would you give to me if I were seeking out a similar position?
So I think if you're interested in any kind of teaching, especially at a higher ed level, or looking at management as much as clinical skill, because I found that when I got into this position, I mean, my clinical skills were amazing, but I really had a learning curve. Even though I've been a retail manager and some other things before, managing in a large organization is very different. And it was one of the things that surprised me the most, I think, as I moved up, was how much of it is about working within an organization and getting these administrative tasks done. So I advise that don't look managerial experience in the mouth. You know, if you get a chance to, manage a team in a dental office, you know, if you get assigned to train younger hygienists or hygienists who are coming in, I think that's a great way to start. And that's how I started. And my other advice would be when you're looking at your higher education, especially a master's degree level, even though dental hygiene is an incredible, there are so many fields that it can be applicable to. And I knew I was really happy when I decided to go with my Master's of Healthcare Administration. Even though dental hygiene is my passion, it gave me a lot of paths. So I think that's one thing to think of is managerial experience will help you in almost any career. And that make sure, when you're thinking about how you want to continue your education, there's so many options that dental hygiene will give you.
That's really good to know. I recently moved to Houston and I've been, I'm in the BAS program trying to get things figured out, but I'm also on the job search right now. So really my task right now is figuring out where I want to kind of settle in. And I remember when we were doing external rotations through Denver Health, one of the hygienists I spoke with was like, yeah, you have to have like 5 years minimum for getting into public health. But I've realized through starting the BAS program that public health is my passion. So what advice would you have for me, starting out as a recent grad to getting to that public health clinical position?
That's a great question. And I would start out with seeing where you can volunteer. Because some of the hygienists I know who really got a foothold in places like Colorado Coalition for the Homeless or at inner city health clinics, some of our Denver local ones, they started volunteering their time. And I did that for a while before I was an educator. They were looking for qualified dental hygienists who were willing to come in and basically work for free. I mean, I'm not going to lie. They're looking for you to volunteer your time. But I was able to do it just 1 day a week. And I started to become part of that community. I got to meet the people who work there full time, meet the administrators, learn more about the organizations. And then I always had those connections. So I think one of the best things you can do in public health before you could apply for, a full-time hygiene, managing the public health clinic hygiene is see if you can volunteer, go to volunteer events, especially when they come back open. If, there's a church group or a health fair, really getting in touch with public health people who are already doing it. And then being around them is the best way to start rather than maybe doing a cold interview. So, and then I know that most time if it's volunteer based, their experience and their requirements are a little bit different. So I know that some newer hygienists can definitely start that way. And then I know I also, when I worked with a temping agency, I let them know that I was really interested in working in Medicaid clinics and public health clinics. And that's not a request that they get very often. So when they knew that I had a mind for public health and I knew how to treatment plan for that population, and that was really my passion, the temping agency I originally worked with out of school helped me find some great places. So those are my 2 tips.
Oh, I appreciate that. Going back to your master's degree that you're working on right now, how do you think that will benefit you above the position that you currently hold? Or I guess what's the end goal for maintaining that degree?
So some of my other goals besides maintaining this position at the school is I'm a very passionate OSHA and infection control trainer. And more people have learned about infection control in the last 6 months than I think ever knew before, but there's still some really high demand out there. And I have thought about, once my education part of my career is over, or as something I would do when I'm not at the school, like during the summers and things when I'm not on contract with the school, would be working with facilities to improve their infection control. And then, of course, the tracking and the management of that. So a big part of healthcare administration is patient safety and all the laws and the rules that go behind that. It's one reason why I was really drawn to this field. So I do, but I talk about it in my degree program all the time. Something I'm very passionate about is the medical dental integration model, bringing dentistry more involved in healthcare and making healthcare more involved in dentistry. And part of my dream is to be one of the administrators that can help some of these emerging combination clinics with both this medical management side as well as my dental hygiene background.
That's awesome. I feel like now more than ever, I hear a lot, especially as a new grad experiencing like licensure and things like that, that integration is it's coming up quick, and that's like really relevant right now. So I
It
appreciate
is. And we don't even think about how revolutionary it is that dental hygienists are screening for things like blood pressure. And we may be able to do simple things like screen for blood sugar, do some depression surveys, things like that. And on the other side, maybe we can go into the medical field, like pediatrician's office, and train the nurses and the nurse practitioners how to do dental screenings in a more informative way beyond the basics that they do. So that's what I'm really looking forward to is having enough of a management position to be able to influence that kind of change.
That's awesome. Well, thank you so much. I appreciate all of your tips and tricks and advice. And thank you for taking the time to sit down with me today.
Thanks so much for having me, Maddie. I appreciate it.